Hi friends, welcome to my channel Dr. Ghosh Presents. This is Dr. Surajit Ghosh, the creator of the channel. I'm speaking to you from Kolkata, India. Today's subject of discourse is heart attack. How do you understand that someone is attacked with heart attack? You can save life. This is the one simple diagram of heart. The main artery called aorta of the heart. The aorta is leaving branches while moving this way and going backwards is leaving branches for distribution of blood. In the blood there are so many constituents. Look at here, LDL cholesterol, fat, dead cells, fibrous tissue, macrophages and calcium. This thing combines to produce a sticky gluey substance called plaque. This plaque accumulates within the layers of internal layers of artery. This plaque is accumulated, and while it accumulates, it takes the innermost layer and this is gradually swells up. The gap between the layers generally swells up due to accumulation of this plaque. Another name is called atheroma. Plaque is also known as atheroma, and the whole process is known as atherosclerosis. Technical term, atherosclerosis. Now see, while it is swelling up, the layer is swelling up, at particular point of time, this ruptures. The layer is ruptures, and at once blood clot form here. Thrombosis, accumulation of blood, coagulation or clotting of blood happens, and the whole lumen space within the artery blocks. No blood can grow from this side to that side. It's blocked, fully blocked. Then what happens? The tissues, cells beyond this level are not receiving blood, so oxygen and nutrition is not reaching in the cells tends to die. The tissue cells beyond this level tends to die. For that reason, serious consequences may occur depending on the situation of the artery. If this artery happens to be coronary artery, then the muscles which are contracting and expanding the heart, for that reason the blood is circulating in our body, that tends to stop. If this contracting and expanding stops, blood circulation is stopped. Blood cannot reach brain. In the center, brain, there are so many centers. The center of heart is also devoid of oxygen, nutrition. So what happens? The whole system goes out of order. The person may even die. This is the actually reasons behind this heart attack. Now we'll take up the matter. How would you understand that someone is attacked with heart attack? You can save life. There are only 5 or 6 symptoms. If you can remember this carefully, then you can easily understand the person has been attacked with a heart attack. The first one is pain, constriction, pressure, felt in chest. The person is feeling pain, constriction and pressure in the chest. So he is taking like this position and his face is anxious, sudden cold sweat is coming. Anxious face with cold sweat. Shortness of breath. Shortness of breath, cough, then comes pain. Pain in left arm, shoulder, pain left arm, shoulder, neck, jaw, back. Sudden pain appears here. Neck, jaw, back. And he can also feel lightness in the head, as if the head is light. Lightness in the head. And with this, nausea, vomiting. If you can see just two symptoms of this, you can almost take it for granted that the person has been attacked with heart attack, provided if the person is 50 years or more, then it is almost sure that that person is attacked with heart attack. Just note the signs: pain, constriction, pressure felt in the chest, anxious face with cold sweat, shortness of breathing and cough, pain in the left arm, shoulder, neck, jaw, back, lightness in head, and nausea, vomiting. Only two, if you see only these two symptoms, you can say that this person is going to be or attacked with heart attack. Only one thing you have to do, only one thing: take the person as quickly as possible to the hospital or nursing home. You can save him or her. There is nothing more to do. Just take the person to the hospital or nursing home. It will do. With this heart attack, I will just refer to two more things. Cardiac arrest and cardiac failure. Very often, persons they cannot identify what is what. Is it heart attack or cardiac arrest or cardiac failure? Mind this, cardiac arrest is completely different thing. In the heart, there is electrical system. The system which is around our house, the electrical system, the wiring, there is also a small type of wiring, and that wiring produces electrical impulse. For that impulse, this heart is contracting and expanding, contracting, expanding. Within the heart, the sounds are heard by the doctors. Stethoscope, lap, do, lap, do. That is formed by this electrical system. In our body, there are only two places where electrical systems are there, in the heart and in the brain. No other systems. Prominently in these two systems, electrical systems are there. So this electrical systems, conduction system, if it is disturbed, then cardiac arrest arises. In that case, the heart may suddenly stop altogether, because when the electrical system is disturbed, the rhythm of the heart, we know that heart pulsate 75 times a minute. That pulsation goes up, pulsation goes irregular, it may suddenly stop. If it suddenly stops, then you see the artery is okay, blood is okay, but the conduction system is not there. So there will be no contraction or expansion. The heart will stop it suddenly and man will die suddenly. Within a minute, he or she will die. That is also a serious thing. But mind this, it doesn't happen generally, because in the system there are 4 steps. If some step is failed, next step is come. That fails, next step. So heart rhythm 75, then comes 60, then 40, then 30. There are so many steps, because in our body system is prepared in that way. If one system fails, then another comes. That fails, another comes. So generally cardiac arrest doesn't happen, because there are substitutes to take up the action, to take up the function. But when this disturbs, generally pacemaker is used, is planted in our heart. Pacemaker is nothing but a small battery that creates that pulsation, so that this contraction expansion again starts. So pacemaker is for cardiac arrest. Mind this, you cannot use this pacemaker in case of heart attack or heart failure, cardiac failure. It is for the cardiac arrest. And cardiac failure is something different. It is a chronic type of disease. When the heart cannot function properly, heart has got some definite functions. It has got some particular amount of blood it expels in each contraction. If due to various reasons this function of heart is disturbed, that is called cardiac failure. It is a rather chronic type of disease and depends on so many things.
Synopsis. This synopsis is prepared for those who might have failed to follow my oral discourse due to my wrong pronunciation. So please read this to understand it correctly. Today's discourse, heart attack. Title: how do you understand that one is attacked by heart attack? You can save lives. Atherosclerosis is a process wherein a sticky material comprising LDL cholesterol, calcium, dead cells, macrophage, fibrous tissue, and fat, etc. is accumulated in the inner wall of the artery with gradual decrease of the diameter of the lumen of the artery. The material is called plaque or atheroma. A time comes when accumulated plaque bursts out the innermost layer of the wall of the artery and blood starts clotting there to fully block the lumen of the artery. Tissue cells beyond that point do not receive oxygen and nutrition. Since blood cannot reach there, tissue cell tends to die. When this happens in coronary artery, heart muscles die, resulting heart attack. Please note the pictures. Top and the top. the lumens of the artery is gradually decreasing shown. Thereafter, in the artery, it is shown how these layers, the inner layer of the artery is swelling up, and finally it bursts. Clotting started. Following are the cardinal symptoms of heart attack. Number 1, sudden pain, discomfort, constriction felt in chest. Number 2, nausea, vomiting. Number 3, shortness of breath, cough. Number 4, anxious face covered with cold sweat. Number 5, pain in left arm, shoulder, neck, jaw, back. If 2 symptoms of the above are seen suddenly in a person, assume that he or she is attacked with heart attack. Then it will be your only duty to take the person to nearby hospital and nursing home immediately. Maybe the person will get a new life for you. On the right side, the picture bottom, the black area of the heart is the portion of the muscles that is already dead due to attack. Thank you. That's all.
আমাদের আজকের আলোচনা শেষ হলো। ভিউয়ার্সদের আমার অনুরোধ, আপনারা দেখে যেখানে অসুবিধা হলো, যা পছন্দ হলো না, যা হলে ভালো হতো, সেগুলো আমাকে জানান। আমি চেষ্টা করব পরের ভিডিওগুলোকে আরও সর্বাঙ্গ সুন্দর করে তুলতে। আপনাদের দেখার জন্য, টাইম দেওয়ার জন্য আপনাদেরকে অজস্র ধন্যবাদ।